Hi, I'm James Hamblin. Welcome to our sixth edition of Yale School of Public Health's COVID-19 Right Now. I am fortunate today to be joined by Krystal Pollitt. She is an assistant professor in environmental health sciences here at the school. And she has been doing some fascinating work getting right to some questions that I know are on a lot of people's minds. I have a few myself that I'll start with, but I wanted to note that if you're watching this, if you drop in at any point, if you have comments, we'll get to them and we will answer whatever you'd like to talk about, if we can. So thank you so much for joining us, Krystal. It's an honor to have you here. The question I always start off with is just, things are evolving so quickly with the news and the challenges, and it seems like there's so much to be done. I always like to know just what is like keeping you up at night right now, really at the front of your mind in terms of we really need to be thinking more about this element of the pandemic or doing more, and what's consuming you.
So I'm thinking a lot about how people are getting infected, routes of transmission, and a route of transmission that's emerging in the aerosol community is how much of this virus is in the air, how long it stays viable in the air for, and what does this mean in terms of what we're exposed to. So how much do we breathe in? Is this a risk?
That's very scary to hear for some people. Is it changing over time? Does it seem like this is becoming more of a significant factor in transmission than some people initially thought?
So originally, the World Health Organization said that airborne transmission is not a pathway that they're looking at. But as more people started to look at what we're expelling from our mouths, beyond just coughing and sneezing, there's a lot of these very small droplets that are coming out that we release. And we release these very small droplets, or we call aerosols, just from breathing and from speaking and from singing. And because they're so small, they have the ability to be dispersed in the air for a much longer period of time than the larger droplets that are expelled than when we cough and when we sneeze. So some of these small droplets can travel 50 plus meters. So it gets well beyond this 6 foot social distancing, physical distancing that we've been talking about.
Yeah. So just to clarify, 50 meters is sort of a possibility in a sort of experimental condition, but we're not expecting that regularly that's happening out in the world, or are we?
So thinking about aerosols being released from our mouths when we're speaking, when we're breathing, that's been something that's been well thought of by the aerosol community. And we know that we're releasing these particles, and we can measure that. And based on modeling efforts, measurement efforts, we can see that these particles will disperse in the air and they will travel, and they'll go well beyond the 6 feet just based on their size.
Okay, these are coronavirus carrying particles that you're referring to.
So they have the potential to be. So if we just think about any aerosol,
right?
So any droplet, very small droplets, that's released, it will be released from our mouths if we are infected or not. But if we have viral shedding in our nasal cavity, within our airways, then some of those droplets that are released will contain some viral material.
Okay. And how much has that borne out in studies specifically with coronavirus?
So it's just starting to emerge. So if we look at, say, even like the last 3 weeks, there's been some papers that have come out, some in preprint, some of that recently got accepted for publication in well-regarded journals, saying that they can measure coronavirus in the air. They can measure it in hospital settings, in patient rooms. They can measure it in adjoining hallways, in different medical regions of the hospital where people are changing, taking off PPE, and also in some public spaces like pharmacies. where people might be frequenting.
And does that suggest that there's enough in the air to be transmissible, or is there anything we can say that you could take away in terms of changing clinical practice or what's being done in everyday life, or is that just still too high? Like, we've found some evidence that it's happening in some ways, but not necessarily in a way that would inform behavior change right now.
So I think you've asked like the spot on question is like, what's the infectious dose? So how much do you need to be exposed to before you're at risk for infection? And that's a big question we don't know. So right now people are just trying to measure it, think about what viral levels that we can see in the air in different types of environments. But translating that to infection is something that has not been done. But what we know now is if it is in the air, then we want to take measures to try to mitigate our exposures. So we know that our risk for infection is going to be controlled by how long we spend in that environment and what the concentrations are that we would find in the air. So we want to try to limit both of those.
Okay, right. So basic principles, like, people have heard that if you're out at a park, it's not going to be the same as if you're enclosed in a subway car,
Yes.
And even if you're the same distance away. Okay, but so it's, how do you feel about the 6 feet recommendation as this thing that is being universally applied to every single scenario? Does that seem based in reasonable thought right now about the potential for aerosol transmission, or do you think maybe we should be saying larger distances in some situations, or being more precise about that?
So if there was someone that was infected near me, or someone even pre-symptomatic, asymptomatic around me, I don't think 6 feet is enough.
Yeah.
Because we do know that there are going to be these small droplets released, and that has the potential. What the infection dose is, that's unclear, but in enclosed spaces, taking sufficient precautions, like wearing the personal protective equipment, ventilation, and others, is needed.
And you've been working on developing wearable technology to collect this aerosol. Can you talk about how that would work?
So a lot of my research is focused on our personal exposure to environmental contaminants, and airborne contaminants specifically. So we've been developing wearable tools that we can measure a lot of chemical contaminants in the air. And this is a natural extension of that. So how can we measure airborne viral material? So we've been working with a group in engineering and also in medicine to see how we can utilize some of the technology and devices that we have to apply it to SARS-CoV-2.
So we're still in the kind of early phases of trying to apply that to the virus.
Yeah, so some of the devices we have take the shape of just a wristband that someone would wear to be able to measure what they were exposed to, and just the better understanding that we have in terms of what's around us to give us some sort of indication on our level of risk for infection.
Sure, right. Okay. So, and what about, I understand it's difficult at this stage to make to comment on advice people are being given about distancing specifically, but maybe about masks. Do you think there's anything that we're clearly missing in guidelines that you're seeing to people about how and when to wear masks?
So masks are critical. Wearing a mask is really important. Even if it's a cloth mask that's home sewed, has some ability to protect you from airborne exposures. Different types of masks will have different levels of effectiveness. And a lot of people have been exploring what the filtration efficiency is of different mask materials. And there's been some really nice studies done within engineering in collaboration with public health and medicine here at Yale that have looked at measuring different material types from the gold standard N95, and then also some of the other variants of the N95 masks to look at how they compare. And not all mask materials, even though they claim to be that equivalent, hold up to have the same filtration efficiency.
Yeah.
Thinking about other material choices, uses of coffee filters have been explored for how well they're able to filter out aerosols of different sizes. Stacking multiple coffee filters have been shown to be somewhat effective. Using vacuum cleaner bags has shown actually to be quite effective. So having some sort of non-woven material, rammed in fiber orientation, those are the materials that are seeming to have the best effects.
That's really helpful. I don't know exactly. I haven't tried to look at how I would use a vacuum cleaner bag or something like that, but I have a sense that the masks that people are being, like the Surgeon General recommended folding a bandana multiple times, and people are wearing like very heavy, ultimately heavy fabrics over their face, and that might have an effect. As soon as it gets hot, people are going to be looking in the summertime for something that could be lighter weight to actually, especially if they have to be outside for a prolonged period for whatever purpose, for work or anything. Is there anything that you know of the materials that you would definitely recommend against that you see people using to make a mask for themselves?
So I think anything is better than nothing. And then it just goes up from there on how much more cautious you want to be. So using a single ply thin fabric is not going to be as effective as multiple layers. So you just using a silk scarf wouldn't be my first choice, but it's better than nothing.
I've thankfully not been using a silk scarf. Do you think then eventually, if there were an ideal world where we had a ton of N95s and shortages were not an issue, that those would be beneficial to be more widely used?
The N95 is the gold standard, but at this point, when there's limited availability, having sufficient supply for healthcare workers, I think that's the first and foremost issue.
Sure. Well, when do you think we'll have some clarity on this infectious dose and exactly what degree airborne aerosolized transmission is playing a part in this? Because people are talking about reopening right now, and it seems like we're going in pretty blind as to how that, trying to be targeted about what specific places people could or definitely avoid versus might start to venture back into safely.
So when there will be some response,
I know there's not going to be one day when we know everything, but are there any big studies or crucial missing data points that you think will really be influential in guiding policy? That are we talking weeks, months, or is it going to be indefinitely long before we can really even say exactly what constitutes safety?
So I come to that as an exposure scientist and wanting to measure everything and evaluating what we're exposed to in relation to risk. And we do this all the time with chemical exposures and other contaminants. So being able to assess what's around us in relation to how long we spend there and what we're doing, I think is the most important. And if we're able to say that being in an enclosed environment that's well ventilated, we're confident that exposure levels would be low and not sufficient for risk for the duration of time that someone spends there, then I think that would lead some pathway to more reassurances for opening.
Yeah, I understand. It's hard to make recommendations like that when it's so hard to ever give someone 100% assurance that they're at zero risk. But we're operating in this world of trying to minimize choosing the least bad option. Do you think overall media mainstream conversation is sort of just not paying enough attention to aerosolized transmission, and should we?
I think it's emerging transmission routes.
Yeah.
And the aerosol community has been working towards promoting this transmission route and really trying to address it and have the highest quality studies to support it.
Okay. So, and are you, since we're speaking generally to the public health community, are there other areas of collaboration with other, I'm wondering specifically about if we're looking at epidemiologic or patterns of transmission that might help inform exactly what that infectious dose is, or how much aerosolized transmission seems to be happening based on where we're seeing the hotspots and how it is spreading at a practical level in the world. Are you seeing interesting collaborations happening in that area? Are you looking for collaborations? Anyone who might be
Yes, so that's one avenue that we're really interested in, is how can we better identify hotspots. It's challenging because we're looking at indoor hotspots that are going to be different for every building type. Mm-hmm. But these community level networks for exposure assessment, that's something of real interest for us, yes. And I think that as people get more resources available for measurement of aerosols and just some more time as people digest this route of transmission, studies will grow in number.
And your work, you've also done work on air pollution and how that influences so many aspects of health, but how does that play into consideration the ways you're thinking about studying this virus?
So there've been some initial studies that have come out to think about how air pollution could affect susceptibility to COVID infection, and a lot of media have looked at these initial results. And I think the most important thing to remember is, as they report these associations that high air pollutants levels are leading to enhanced COVID infections, that these are really preliminary studies. And they're really just starting to scrape the surface of the iceberg in terms of the data that's coming out, where infections are occurring. And it's been really difficult to control for all of the different factors across the different cities.
Okay.
So it's an interesting preliminary insight. But it's going to need a lot more solid analysis before I really pay attention to those conclusions and have a lot more confidence in them.
You're referring to kind of the basic idea that there's an association between places with
yes, exactly.
levels. Okay. I guess I would assume that might affect like people's pulmonary function if they're living in a high pollution area, and so they might not be affecting the transmissibility versus someone's propensity to get especially sick versus their baseline health. When we talk about aerosols traveling such long distances, forgive me if this is a dumb question, but it does seem then you have factors like weather that could change patterns. People have been pretty dismissive of claims from some officials that this might go away in the summer, but how generally is there any possibility of that effect changing transmissibility significantly with a virus like this?
So when we think about aerosol transmission, we're really focused on the indoor environments. So yes, we can think about how the virus viability will differentiate when it's higher temperatures and different humidity levels. But for that indoor environment, if those factors are so well controlled that that spreads is independent.
Okay. So the only relevance there might be that if there's a season where people are spending more time indoors, then this could become a more significant factor than the season where they're spending less time indoors.
Well, I think that also comes down to what are the stay-at-home measures that are being required.
Sure. I I hope they're pretty wide, but I think in the short order, near future, they're in much of the country, it seems like they're going to be pretty patchy. Is there anything that I haven't asked about that you wanted to make sure that our viewers were aware of, or to circle back to that we touched on earlier?
I think we've talked about a lot of different topics, unless there's something else you want to go back to.
No, and I don't see that we have viewer questions right now. So I appreciate the caution with which you're sharing these concerns, and it sounds like in terms of practical takeaways for everyone, just right now, we should continue to just assume that that this is spreading farther than 6 feet in the air, and that you should wear a mask, whenever possible on that assumption. We'll hope that it's not doing so to a significant degree widely, and but we're waiting on studies from people like you to tell us for sure exactly what appropriate distances would be and what the safest arrangements for indoor spaces are. If I misstated that, please tell me. Does that sound right?
No, maintaining physical distancing is important. Wearing a mask is important. That's all.
Yeah.
That's all that I would say.
Well, I'm definitely going to keep up with your work. This is fascinating. Thank you so much for talking with us today.
Thank you for having me.
Okay. Take care.
Bye.